Hey there, how are you doing? I'm Star Penn. I am the founder and the creator of the JIA Blueprint, where I help moms go from feeling overwhelmed, stressed out, terrified over their children's juvenile arthritis diagnosis to feeling empowered and strong and calm, knowing that they have a way out of here, helping them to live their life with their family now and really be able to fully enjoy it while also getting their JIA child on the road to health and healing so they can have a happy and full future. So today what we are going to talk about is the Methotrexate and sometimes the mouth sores that accompany this medication. And we're going to talk about why this happens, what's causing it in the body, ways that we can handle it with natural remedies, and ultimately how to eventually not need these medications like these anymore and gradually be able to come off of them so our child can be healthy. So that's what we're going to talk about today, the mouth sores that we see common with methotrexate medication. So if you're in this scenario, your child was diagnosed with juvenile arthritis, prescribed methotrexate, and now they have some sores in their mouth, then this video is for you. And we're going to talk about why our children get these sores in their mouth when they're taking methotrexate. So while methotrexate its function is to suppress the immune system, unfortunately, it also triggers another immune response. It's something that's called mucositis. And it was something that, I don't know if you've heard about it from your rheumatologist, but I would certainly ask about it. It's an inflammatory reaction to the medication, and mucositis will cause sores in the mouth. So that's why your doctor likely will prescribe to you folic acid. The folic acid is intended to deal with that inflammatory response. But however, it doesn't really always give us complete relief. Some people are perfectly fine, but some people, even when they take the folic acid, they still struggle with mouth sores. So we really want to be aware of this, because here we are taking something that is supposed to help stop an inflammatory response. And now here we have it where we're taking it, it's creating an inflammatory response. Now we have to take something else to try to stop that inflammatory response. And it's, a matter of one thing leads to another. Hopefully, if the folic acid is working for you, that's wonderful. But it's still good to know what the inner workings are and what's going on in the body, because really what we're seeing is we're just masking one thing with another, which is okay to do in order to get control over what's going on in our children's body, in order to get a handle on their health. If we can minimize or alleviate their symptoms so we can heal their body, that's great. But to think that these things are actually healing the body or, making the body healthy, no, it's not. One thing is, is a Band-Aid for another and is a Band-Aid for another. So if the folic acid is working for you, that's great. But just remember, these are just Band-Aids to other underlying issues, okay? So just something to keep in mind. So in addition to folic acid, if our child does end up continuing to get mouth sores, the next mode of action, for lack of a better term, is we'll be prescribed some mouthwashes, sometimes just over the counter, some medicated mouthwashes, and these can provide some relief. But we want to talk about really what are these mouthwashes doing, because the mouthwashes that we get prescribed or get from the store have alcohol in them and very often have chemicals in them, all of which kill all the bacteria in the mouth. It's almost like an antibiotic for the mouth. So it's killing, every time you use mouthwash, even over the counter, it's killing all the bacteria in your mouth. It's not differentiating good or bad. So you end up, just like you do with an antibiotic to your gut, whenever you use mouthwash in your mouth, you're creating a worse situation. Your breath might smell good for a minute, but you're really creating a worse situation where more superbugs can grow. And so we want to be leery of just jumping from one Band-Aid to another. If these mouthwashes bring some relief, that's wonderful, but still to be aware of what they're doing to our child's mouth. And why is that so important? Well, a lot of us aren't really fully aware, we don't really ever thought about it, that our mouth is really the beginning of our digestive tract. The digestive tract starts in our mouth, goes all the way down our body, it ends at the rectum. That's our digestive tract. It's not just our stomach. So if the mouth has sores, or if we're killing all the bacteria in the mouth, these things are a window for us into what's going on inside our child's body. We get a window of the gut, by the health of the gut, by looking at the mouth. So if our child has, sores and lesions and, pain in their mouth, bad breath, that was one of the early symptoms for my daughter, not related to the methotrexate, but anything that we're detecting in the mouth is a window into what's going on in the gut. So if we're killing the bacteria in our child's mouth, then we're actually killing the gut bacteria as well. Or if we're killing the bacteria in our child's mouth, how are we going to replenish? Because this is really all one thing from top to bottom. So we want to take as good a care as our child's mouth as we can. So how do we do that? When our child is on methotrexate, they have mouth sores, they're using folic acid, we have this mouth, but we kind of go down a road of like, what do we do? Because it is devastating to see our child in pain like that. It doesn't just hurt them, the whole family, is affected. So I wanted to share some things that you can do for temporary relief, but also long-term relief for these mouth sores. So the first thing I wanted to share with you is the use or the practice of oil pulling. By now, a lot of people already know what this is. If you don't, it's an ancient Ayurvedic practice. And what we're doing is we're taking an oil, specific types of oils, and we're swishing them in our mouth, usually for about 10 minutes. And what this practice does is it pulls out toxins and bacteria from the mouth, and then you're able to dispel them. A very popular oil to use for oil pulling is coconut oil. And the reason why I really like coconut oil is for its antimicrobial, antifungal, antibacterial properties. So when we oil pull with coconut oil, we are in effect handling a lot of the bad bacteria in the mouth, killing a lot of the bad bacteria in the mouth, but coconut oil won't kill any of the good bacteria in the mouth. You see, this is different. So it's like what you would do with the mouthwash. It's the same idea of what you do with the mouthwash. It's going to cleanse those wounds. It's going to heal, help heal, repair. But we're not completely wiping out the microbiome in the mouth. We're keeping the good bacteria intact. So after you oil pull and then brush your teeth, your child's mouth is in a much more healthier state. The oil pulling doesn't just clean the wounds and help them to start healing, but it also is very soothing. It's anti-inflammatory, coconut oil. So it's going to calm those wounds down and put their mouth in a wonderful condition to start healing. The only consideration or two that you want to consider with oil pulling is, one, can they swish oil in their mouth for about 10 minutes without swallowing it? Because think about it. We're pulling toxins out of our mouth. We don't want to swallow them. And then another thing to keep in mind is, although anybody can oil pull, and I recommend everybody does at least once a month, this is something that can be done every day. However, not to exceed more than once a day, because it really is that powerful, and you will feel a negative reaction in the mouth, an aching feeling in the mouth. If you do too much, it really does pull a lot out. So you want to be conservative with that. So your child could oil pull once a day, and so can you. And I just wanted to limit that because it does feel good while you're doing it, but this isn't something that they should be doing multiple times a day. So oil pulling once a day. And another thing that is wonderful for for the sores in our mouth would be a salt water and baking soda combined mix. A lot of times we'll hear to rinse with salt water, and that's great. It'll cleanse the wounds. The baking soda added really adds another level of pain relief, and it balances the pH in the mouth. Again, keep getting that inflammation response under control. And you really do feel an instant pain relief by combining the two together. And so that you can just have sitting on the counter, and that's something they can swish with in their mouth and gargle as often as they want. This is something you can do every single day. And so those are the immediate, the things that you can do for pain that are natural, pain and healing, that are completely natural and beneficial for the body. And then if we start to think, okay, well, what's the long term, right? Because we talked about how the microbiome in the mouth matches the microbiome in the gut. If we don't want to get sores in the mouth, we want to take care of the microbiome in the gut. If we have the microbiome in the gut nice and fortified and healthy, we will not get mouth sores. We will have that microbiome will match, and our mouth, our body will be able to withstand the effects of the methotrexate. So how do we do that? Well, obviously we could take a daily probiotic and a prebiotic as well. Both of those are going to help. A prebiotic feeds the good bacteria in the gut, so that way it has something to grow on. And a probiotic, well, that is good beneficial bacteria. And so that's something that you can give your child. There are also over-the-counter oral antibiotics that they're for the mouth bacteria. So this is something that you can buy, get at the health food store or online. And these are the very specific strains that reside in the mouth. And that's going to help build up the good bacteria in our child's mouth. The more good bacteria there is, the better that they will be to fight infection, inflammation, and different things in the mouth, and keep those mouth sores to a minimum. Another way to get probiotics in our child, and my favorite way, is through foods. We want to look at foods that are fermented, things like sauerkraut, pickles, any kind of fermented vegetable or even fermented fruit is going to be beneficial for our child's gut, which is going to, again, take care of their entire digestive tract. Cultured dairy is another one. Now, I know a lot of us are told, if we're even leaning in the natural realm and our child has juvenile arthritis, that we should be avoiding dairy, and maybe you've even experienced where there's a direct correlation between a dairy product and joint pain or inflammation in your case. And that is very likely. And that's usually, if not always, because of we're drinking pasteurized dairy that's been very highly processed and basically dead, basically heated up to such a degree that it is essentially a dead food, and it can be very inflammatory for us. And even cultured products, when we culture dairy, we bring it back to life, right? We're putting good bacteria back in it. So that's good. And that makes it more tolerable. But we want to be careful also of even store-bought cultured dairy if our child has a condition like juvenile arthritis. And that's because they're never really properly cultured. A lot of times they just add like a culture to it. They can put things on a label. Also, they really, even if they do actually do an actual culture with live bacteria, it's a quick process. It's just enough to get it cultured. I recommend making your own cultured dairy and culturing that for at least 24 hours. And that's nowhere near as close as what they're doing with the conventionally made cultured dairy. So that is the big difference maker. Cultured dairy is so unbelievably good for us, but we need to really be careful where we source it. And it's a very good idea to make it yourself. And of course, if your child does struggle with dairy, it would be something that you would want to start in very, very small doses. The benefits absolutely outweigh the risks when it comes to cultured dairy. If it is something that your child can't tolerate, if your child can't tolerate milk. That's understandable. It's full of sugars. It's full of milk proteins, all of those things that would cause a reaction, an inflammatory reaction. But when we culture our dairy, the good bacteria that's in that culture eat up a lot, most, if not all of those sugars and lactose and different things that now just make it this powerhouse superfood. But even though it is a superfood, same goes for the fermented vegetables. It is something that we want to gradually introduce to our child because it is very powerful. So you might get a completely different reaction from a fermented vegetable or cultured dairy than you would from like store-bought or from milk. You might think they're the same thing, but really what's happening is you're getting an inflammatory response from the store-bought foods or the foods that aren't fermented, whereas when you culture it yourself, you're getting a die-off response, meaning that this product is so powerful, it's killing so much bad bacteria at once that it's more than your child's body can handle. So it might look the same, it might look like a flare, or it might look like stomach issues, and it might look like, oh, my child can't tolerate this, but really it's actually doing a really good thing. But we just wanted tiny, tiny, tiny little bits and work our way up. So, some of my clients, their kids can't handle more than an eyedropper full of pickle juice in a glass of water at first. That's how powerful that is, and that's how imbalanced that their gut is. And then little by little, we inch up. So if you want more information on that, more clarification on that, you can reach out to me. But cultured dairy, homemade, is absolutely a product that is going to be a key player in helping your child to heal and rebuild their gut microbiome. And it is a very powerful food, and it's something that we want to treat as powerful as it is and introduce it in micro doses very slowly and up and up and up. Okay. And so those are a few things. And then we also need to focus on our child's detoxification. If our child is having mouth sores, this is an inflammatory response. Whenever there's inflammation in the body, that means that our child's immune system is working. It's trying to do a good thing. But we're seeing this heat reaction. I always say, think about a fever. When our child has a fever, it means that the body's healing itself. Anytime there's inflammation in the body, that's a signal that the immune system is addressing an issue. And the fact that we have the inflammation is telling us I'm struggling and I can't do this on my own. And so we want to look at that inflammation as information and start to assist the body in what it's trying to do. So if our child has mouth sores, we definitely need to help to cleanse the body and get these toxins out, because anytime there's an inflammatory response, that inflammation is a byproduct, a waste of what the immune system is doing. And we need to get that waste out of the body. We can't just sit there with that inflammation just going nowhere. And if we don't get it out of the body, these toxins that are created from the inflammatory response are just going to circulate through our child's body. This is how we get deeper underlying infections. This is how we have an autoimmune disease spreading throughout the body, and just overall not a lot of health taking place there if we're not also supporting the body in detoxification methods while we're rebuilding the body. So there's lots of different things going on. This is not just about probiotics. This is not just about putting a Band-Aid on something, but really understanding what's going on in the body and how we can gently support the body and help. Because ultimately, if our child is on methotrexate and we want to get them off methotrexate one day, or we want them to not have to always be worrying, like, when you do come off of it, like, oh, is it going to come back? But you're actually really healing the body and giving your child a new body. If we really want that, this is something we need to take serious. It's something we need to be patient with. It's something we have to know that we are rebuilding their body. It's not going to happen overnight, and it's not a Band-Aid. This video is not about, oh, here's the Band-Aid to fix that. That's not what we do. This is about how do we overall address all of the underlying things that are taking place in the body so the body can heal itself and it no longer is sick. So we're not just getting rid of the mouth sores, right? We're getting rid of the cause of the mouth sores and the need for the cause of the mouth sores, and even the original, right? The joint pain that got us in the doctor's office in the first place, and even further, the imbalanced gut and sluggish detox organs that got us with the joint pain in the first place. We got to go layers deep, 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 deep. So I hope this information was beneficial for you. I hope you understand some little tricks and tips that you can use to alleviate the pain associated with your child's sores, but also hopefully to see juvenile arthritis in a slightly different light. I know I can't cover everything inside this video. That's why I make several. So I encourage you to go ahead and take a look at some of my other videos. Hopefully there's another topic there, something that you find that is information that you're looking for. But by all means, if you need more information, feel free to reach out to me. I'm always happy to help. Subscribe to my channel. I make videos every week with different topics that address different areas of juvenile arthritis, and they are primarily designed to help you, the mom, the parents, the grandparent, the caregiver, to take care of your child with juvenile arthritis, to deal with the here and now and what they have going on, but also to get them on the road to healing. So I hope this information was helpful. Subscribe, like, share, and I will see you on my next video.